Sorry about that. My video actually cut off. But anyway, I had got the call saying congratulations. The doctors reviewed your notes and felt that you would be a great candidate for tubal reversal surgery. So this was the offices of Dr. Samay Toma with North Carolina Reproductive Medicine in Cary, North Carolina. Was so excited that dang near jumped out of my seat. I was like, okay, is he sure he read my doctor's notes and felt that I can still have a successful surgery? I'd be honest with you, it didn't even feel real. I was so skeptical that they read the wrong chart and it wasn't mine. Okay, so fast forward. Surgery was on the 18th, last week, Tuesday, and they give you the talk prior to the surgery of all the factors that would be successful for surgery, for tubal reversal surgery, and that is length of tubing that is able to be reconnected and is healthy. So that was a big concern for me because of the fact that mine was cauterized in several locations, and so I didn't know if I was going to have viable tube left. And another factor was scarring, which is something that still is to be determined. Age is a factor, of course, as always. And there was another thing, but I can't remember at this time. But the main thing that I was focused on was length of tubing that was going to be healthy after the procedure. So I went into surgery. Surgery went extremely well. When I came out and I woke up, the nurse was there and she was smiling and she was like, "We have good news for you." She's like, "But I can't tell you because Dr. Toma likes to have the discussion with the patient and give the good news himself." So that relieved all of my anxiety when she said that. And so when I met with the doctor, he told me that I had 7 centimeters of healthy tube reconnected at both sites, and I was so happy. Now, I did fast forward too fast, but before I went into surgery, I had the ultrasound done, and they could see from the ultrasound that both of my ovaries actually had 3 follicles in it. So that was positive right there for me. I was so excited about that. So now having the tubes reconnected, it was successful. The surgery was successful, and now we have this waiting period of the first healing, and then you have to make sure that once you do start back having intercourse, that you have to make sure there's no ectopic pregnancy. So you have to have your, I believe it's HCG levels checked like every 2 days, just to see if you're pregnant, and if you are, to have an ultrasound done to make sure that the pregnancy is not in the tubes, because if it is, then there is a shot they can give you now that can dissolve the pregnancy within 24 hours, something like that. So we're definitely going to be mindful of that, but we're going to stay prayed up that that doesn't occur, and keep pressing, moving forward, keeping myself healthy, my husband keeping himself healthy, and we're just going to stay faithful that I'm going to heal properly, and things are going to move forward as they should. As far as healing, if you see I'm out of breath a lot, it's because I had open surgery. I didn't have the laparoscopic. I had the open surgery, so it's like a mini cesarean. So there's a lot of pressure in my lower lower abdomen area. Walking, I'm still kind of a little bit hunched over, but in the beginning, like right away, it was like I could barely even lift my body all the way up. It was very painful, and because of the way I'm walking, there's a lot of pressure on my lower back, so my back is like always hurting. So been using heating pads to kind of offset that, and really taking it easy, but making myself move around. That is very important, is to make sure that you make yourself move around, because of the fact that you could get blood clots, and I'm definitely trying to avoid anything as such for that reason. So I have been moving around, and actually once I get moving, I find that the pain is not as bad as it is when you first start. Still very sore down there in the abdomen area where the incision is, but the incision is healing fine. I don't have like no drainage or anything like that going on. I have the steri strips that are on my incision, and those I was told is going to come off on their own in time. So I've been keeping that area dry, and and pretty much clear. A note that I didn't mention was I do have support from my friends and from my husband's family for me going through this procedure, but I'll be honest with you, I did not immediately get support from my family about me doing a tubal reversal and going through this, because in their mind, they felt like at this point, you're a grandmother, you shouldn't be trying to have any more children. And I just want to let you know that if you do run into something like that, where you have friends or families or any outside source trying to discourage you and tell you what you can and can't do with your own body and your own life, don't let that be a deterrent for you. Those people, you don't know what's going on in their own inner circle and in their life, or why they feel like they can dictate what's going on in your own. Press forward. Stay strong in your own self and your own belief, and you do what you feel makes you happy, because this is your life and you have to live your own life. They live their own and you have to live yours, and they can't make decisions for you. They can't live your life for you. You can always ask for advice and listen to advice from people, but that doesn't mean you need to take it full-fledged and run forward with it. You still, at the end of the day, have to be comfortable with the decisions that you make for your own life. You have to be comfortable in your own skin, and at the end of the day, it's about your joy. So live your best life, and just stay faithful in your own beliefs. And I just wish everybody much success if you're going through a journey similar to mine, or if you have been through it and you feel a little bit deterred by it. Just keep yourself with positive people around you. Stay positive. Do things that make you happy. If anything should not go your way for one moment, sometimes you can take a break from it, but don't stay away. Just press yourself forward, and I wish you best of luck. I hope this video gives some type of encouragement to someone, and I thank you all for even giving me a time to speak with you today, and I hope you enjoy the message that I have brought forth to you. Praise and blessings to everyone, and I wish you much success. Thank you.